Hi, good morning, Patrick. My name is Mihiraa. Let's start the warm-up session. Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Hello Mihiraa, thank you for coming in today. I can see you're looking a little anxious, and I want you to know that I'm here to help you through this step by step. My name is William Greyfield, and during today's routine checkup, I've noticed a couple of things in your clinical readings that I need to discuss with you carefully. First, I'd like to explain what we have found. Your blood pressure today is higher than what we would expect at 28 weeks of pregnancy, and we have also found a small amount of protein in your urine, which we call mild proteinuria. These two findings together mean we need to look more closely at how you are feeling and whether you have noticed any other changes recently. To begin with, could you tell me if you have experienced any new or
Thank you, William. I was feeling fine until yesterday, but now I am a little worried. I have had some swelling in my fingers and face, but I thought that was normal in pregnancy. No severe headaches, but my eyes feel a bit blurry sometimes when I read. No nausea or stomach pain.
Thank you for sharing that openly, Mihiraa. I appreciate your honesty, and it is very helpful that you told me about the swelling in your fingers and face, as well as the blurry vision. Now let me introduce what we are looking at. Based on your elevated blood pressure, the protein in your urine, and the symptoms you just described, especially the swelling and visual changes, we need to consider a possible condition called pre-eclampsia. This is a pregnancy-related condition that can affect both mother and baby, but I want to reassure you that at this stage, what you have is mild. The complications can include risks to your liver, kidneys, and blood clotting, and for the baby, it can affect the blood flow through the placenta. However, with closer monitoring, we can prevent serious complications, and many women go on to have healthy pregnancies with proper care. Right now, because it is mild, we have a very good chance to manage it well. Does that make sense to you so far?
It makes sense, but I am scared. What happens next? Can I just come back next week for my routine appointment?
I completely understand that you feel scared, Mihiraa, and it is normal to feel that way. Let me explain the immediate next steps clearly. You cannot wait for your next routine appointment. Instead, you need to go for a same-day assessment at the hospital today. At the hospital, they will do blood tests to check your liver and kidney function and your platelet levels, a urine protein quantification to measure exactly how much protein you are losing, and fetal monitoring to check your baby's heartbeat and movements. This is very important to do today. Do you have any concerns or questions about going to the hospital today?
All right. What steps should I take in the future to manage this condition effectively?
That is a very thoughtful question, Mihiraa, and it shows how committed you are to keeping yourself and your baby safe. Let me explain what steps you can take in the future to manage this condition effectively. First, you will need to come for more frequent clinic visits, and I know that can feel tiring, but each visit has a specific purpose to protect you both. At these visits, you will have regular blood tests that check your liver, your kidneys, and your platelets, which are the cells that help your blood clot properly. These tests tell us if pre-eclampsia is affecting your body's organs. You will also need to give repeat urine samples so we can measure whether the protein in your urine is staying the same, going down, or increasing. In addition, we will arrange special fetal growth scans and Doppler studies, which are ultrasound scans that look at how well your baby is growing and how healthy the blood flow is through the placenta to your baby. For your self-care at home, I want you to rest as much as possible, and when you are resting, always lie on your left side because that position improves blood flow to your baby and helps your kidneys work better. Most importantly, you need to monitor your baby's movements every single day. You should feel regular kicks and rolls, and if you ever notice a decrease in how much your baby is moving, you must contact the triage unit immediately without waiting. These steps may feel like a lot, but together they give us the best chance to catch any changes early and keep you both healthy.
I can manage that, but what about pain? I sometimes get headaches. Can I take my usual painkillers?
That is an excellent question, and I am glad you asked. For pain management, paracetamol is safe to take during pregnancy. However, you must avoid ibuprofen and any other NSAID painkillers because they can be harmful to your baby and can also affect your kidneys, especially when we are worried about pre-eclampsia. So only paracetamol, and always follow the dose on the packet.
Okay. Could you please let me know if there are any particular symptoms I should monitor or seek help for?
Yes, absolutely. Mihiraa, it is very important that you know exactly when to seek urgent care, Not to frighten you, but to keep you and your baby safe. You must come to the hospital immediately or call an ambulance if you develop epigastric pain, which is a pain just below your ribs in the upper middle part of your tummy. This can feel like bad indigestion but is actually a warning sign from your liver. You should also seek urgent care if you notice a definite decrease in your baby's movements compared to what is normal for you, because that can tell us if your baby is under stress. In addition, if any of your symptoms get worse, such as a headache becoming very severe and not going away with paracetamol, your vision suddenly blurring more or seeing flashing lights, or if you start vomiting or have sudden severe swelling in your hands and face, please do not wait. To support you, I will give you an information leaflet on hypertension in pregnancy, which explains everything we have discussed today in simple language. I will also write down the contact details of the triage unit for you. You can call them anytime, day or night, and they will tell you what to do. Please keep this leaflet and the number somewhere safe, like on your fridge or in your handbag, so you always have it with you. You are not alone in this, Mihiraa, and help is always just a phone call away.
No more questions, William. You have explained everything very clearly. Thank you for being so kind.
You are most welcome, Mihiraa. You have done the right thing by coming to your checkup today, and that has allowed us to find this early. I will now call the triage unit to let them know you are coming. Take care, and we will see you very soon.